Talking about carcinoma cervix post-op indications for external beam RT. So carcinoma cervix, we know that for stage 1 to 2A, the main treatment is surgery. So in surgery, you have to do total abdominal hysterectomy plus bilateral salpingo-oophorectomy plus or minus a lymph node dissection, pelvic lymph node dissection. 2B onwards, we know that the treatment is radical CT plus RT. Radiotherapy, chemotherapy plus radiotherapy followed by brachytherapy. So in these cases where stage 1 to 2A, where you have operated, then you will see for post-op report like HPE report, if this shows high risk features. So in high risk cases, high risk or positive nodes, positive parametrium and positive margins. So these are high risk cases. These have recurrence with, like, only with the surgery they have recurrence risk of 40% local recurrence, and the death with this, like without the adjuvant treatment, the death is around 50%. Now coming to intermediate risk, with intermediate risk, the recurrence risk and death risk is around 30%. So in high risk and intermediate risk, in which cases will you give adjuvant radiotherapy? So in high risk cases, if any of these criteria is present, this is according to Peters criteria. You have to give external beam radiotherapy, adjuvant external beam radiotherapy, if post-op there is high risk of high risk cases. Now coming to intermediate risk. So intermediate risk is based on Sedlis criteria. Sedlis criteria is based on 3 factors: LVSI and tumor stromal invasion and tumor size in centimeters. So if there is LVSI present and if the stromal invasion is superficial 1/3, then the tumor size should be more than or equal to 5 centimeters. In that case, adjuvant radiotherapy is required. Another scenario, again LVSI positive, if mid 1/3 of the stromal involvement is present, then for the tumor size should be more than 2 centimeters. In these cases, we will give adjuvant radiotherapy. Now another scenario is again LVSI positive. If deep 1/3 is involved, then no matter any size of the tumor size, you will give adjuvant radiotherapy. In deep 1/3, if the stromal involvement is deep 1/3 and LVSI positive, then any tumor size you will give adjuvant therapy. Now in case where there is LVSI negative, then either the mid or deep 1/3 has to be involved and the tumor size should be more than or equal to 4 centimeters. In this case, you will give adjuvant radiation. So this is Sedlis criteria.